I'm Dr. David Beaulieu, and I'm here once again with Ross Smith, and more news you can use about EFT. EFT is a tapping technique. It's called emotional freedom technique because it allows you to get to emotions that are not working for you, that are blocking your ability to move forward in your daily life from a personal, relationship, business, and health standpoint. It's not just compressed into, let's see if we can use EFT to help with our headaches. EFT can help you in all areas of your life. We've been talking about someone who's a youngster, maybe in the second grade, who has to give a presentation and has a very, very bad experience, and this, at the subconscious level, continues to be a problem. Every time a presentation needs to be made, either an individual in a classroom or before a group, there's all kinds of fear involved with this. And so we want to open the door to the subconscious, the source of the fear, and we've opened the door with tapping on an acupuncture point with a statement about being afraid of public speaking.
Yes.
And then we've gone to repeating that statement, first determining the degree of severity on a scale of 1 to 10. 1 being not very bad at all, 10 being, oh boy, you've got a problem. And we determined that this was going to be like a 7, and it created a burning problem in the pit of the stomach. And we went about the tapping around various acupuncture points to open that door and create a communication with the subconscious. When you tap these acupuncture points, the door to the subconscious opens up. The subconscious begins to pay attention because this isn't just a random thought. This is a thought while we're accessing the energy field that the subconscious controls. So we've got the subconscious's attention at this particular point. The subconscious, Ross, pretty much does it all. Other than conscious will, everything else in the body, advanced reason and advanced will, is conscious. The beating of the heart, the 3,000 different jobs that the liver does on a daily basis, breathing, blood pressure, kidney function, it handles the computer, the factory, the filters. The subconscious runs the whole show. It's, we all know that we have this brain, this marvelous computer, but we've got a programmer. We've got a subconscious that puts stuff in and takes stuff out. So we need to access that. And every physical condition has an emotional component. And every emotional condition has a physical component. And sometimes in our office, what we have found is that we deal with the physical component and the emotional components go away. And I know what you found is that you can deal with emotional components and physical components go away, but not always. Very often in the office, we're dealing with people with some pretty severe problems. And we go to a certain point and they get better and they get better and they get better and then they get stuck. And we've run smack dab into an emotional component. And I want to talk about this, a particular person. I referred a lady to you. She came into the office. I've been struggling with her for a number of months. She's on all the right nutrition, but she's having a tachycardic problem. She's having a heart problem. I know you know who I'm talking about.
Yes.
And she came in, and you treated her once. Okay, so she's not going to a psychological counselor for emotional problems once a week for the rest of her life. Okay? One time. And run through that with me. What did you do?
Well, like we did last week, I went through finding out what the emotion was that she was experiencing.
Right.
We ranked it, where it was 0 to 10. How are you feeling about that? Is it, how distressful is it? And then we found the physical component. Where are you feeling it? Where's that coming up?
Okay.
And then we did the setup like we showed last week. Do it on the karate chop while we make the statements.
Yeah.
The target emotion, and then the acceptance statement on the other side of that. And then we went through the points with a reminder statement of what was going on, what the target was that she was wanting to clear up.
And you did that over and over till the numbers came down?
Yes. And there was other things that came up, aspects as we call them, other things that come up all of a sudden that shoot up into a person's brain while they're doing this system, because I think the body's anxious to heal itself, is my opinion. I think it wants to heal itself. We have bodies that are built for health. They're not built for disease.
That's right.
And EFT helps clear those things that are blocking that health.
And one of the things that we've learned, and it's used in courses where people like to remember names and things of that nature, improve memory, is that the subconscious will group things, usually like things, not always, but usually like things together. And so if you've got a negative emotion and there are other negative emotions that seem to be closely around it, they'll pull them together and put them in a similar spot. When one comes up, a group will tend to come up. So you're dealing with often more than one thing. You're clearing a number of things all at the same time.
Yeah, that's exactly right. And what we're taught in EFT training, certification training, is that's called the tabletop. There's a tabletop emotion, but it has many legs to it that hold up the tabletop.
Okay.
So you might have 20 legs that's holding up a tabletop of fear, a fear. And the more specific you can get in EFT, the better off you are. Global tapping around just say, I'm afraid, and then you tap it. You're not going to have a lot of results. But the more detailed you can get around whatever the emotion is, the better off you are of eliminating it. So anyway, there might be 20 table legs holding up this table, but you might just have to clear 4 or 5 or 6 to get the whole thing cleared away. You don't necessarily have to go through each individual aspect. Because it's been my experience in my life that I've had many things contribute to emotional blocks in my life around that made the tabletop, but I've cleared them not having to go through every event that happened in my life, just primarily the big T trauma types.
Boy, that saves you a lot of time.
It does. It's the generalization effect.
And this particular patient had been not only to us, but to a number of cardiologists. And now, occasionally, she'll have that response pattern. We've talked on the telephone a number of times. And she said, I tap. I sit down for a moment. I do my tapping. I do my statements. And my rapid heartbeat, my tachycardia, just goes away. Yeah. Now, that's amazing.
It is. And I think the way it works, I know the way it works is when we tap on these acupuncture points, it's sending an electromagnetic impulse up through the meridian, and it's sending it to this stress mechanism, the amygdala, or at least the sympathetic nervous system, and it's telling it, cool your jets. Everything's okay.
Yeah.
This will be fine. You're all right. And that impulse is what really calms down that center.
Something like this is incredibly exciting. And what I like about it, I think the number one point to me is that do you have to go back and deal with that practitioner over and over and over again? I know with my baggage, I do, because it's not just like I would have a fear of speaking, which obviously I don't. But there are so many different levels. We all have this baggage. And what I like about it is you deal with one thing at a time, but you don't come back and talk with, let's say I'm the practitioner. A patient doesn't come back and talk with me every week for 3 months to get rid of a piece of baggage. You identify the baggage, you teach the patient to deal with it, and they go away. and they deal with the problem till the next problem raises its ugly head, and then you come back and you deal with that problem, whether it has to do with health, whether it has to do with work, whether it has to do with relationship. It's a remarkable technique that gets to the source of a problem when the physical approach that I use has hit a block. So basically, you bail me out.
It's just another tool in the toolkit.
Another tool in the toolkit. I like that. It's a good way to describe it. We'll be back.